Bueno, buenos días. Antes que venir los slides, voy a contar un poco. Yo, como muchos finlandeses, tengo background de mobile telecomunicaciones y soy de Nokia, de Real Networks de Estados Unidos y después de Rovio Entertainment, conocido por Angry Birds. Y además estuve trabajando aquí en Embajada de Finlandia en área comercial, donde tenemos Daria aquí también presente. Y bueno, ahora estoy aquí para hablar sobre corazón. Todos tenemos, pero tengo que cambiar para inglés o spanglish, lo que sea, porque para no perder los términos de traducción. Yo no soy médico, pero vamos. Bueno, eso es un facto. Cada uno de tres personas aquí van a tener problemas de corazón antes o después. No solo aquí en esta sala, pero en el planeta todo. Entonces, y cada uno de cuatro puede tener un ataque también cerebral. Pero 2/3 de esos podemos evitar si vamos a encontrar ese caso antes y con medicación. Y solo para recordar que este atrial fibrillation, vamos a hablar AF, es para 40% de todos esos casos que van a causar. Entonces, inglés ahora. So, in the last 20 years, there's still no progress at all in the World Health Organization stats that the most common causes of death are still ischemia and the heart strokes. And we want to change this. So in Europe, we have about 100 million people in the risk area. Okay, we have the elderly people, but it's not only for the elderly people. Everybody can have heart problems. We have also a company here in Spain who are using my famous idol, Iker Casillas, who had to stop playing football because of the heart problem. And I have to admit, I am Madridista as well. We have done also app for Real Madrid to measure the speed of the shot. So I do have some sympathy for Senor Casillas. So more than 65 or 75 are now in the new EU regulation that they will be screened either systematically or randomly. And we have just a perfect solution for it. So we have our own device. It looks like this. It's a simple device. You put it on top of your heart, 30 seconds, but to the bare skin. And I have a good news for the men. You don't have to shave like in the halters. You know, normally the nurse, you know, have to do some shaving, and this is also time wasting, and you don't actually need halters at all because it's time wasting and it's expensive, and it doesn't work for the big screening at all. So we have an app, and what I learned from the Angry Birds is that if the app is easy to use, so the idea was that the 5 years old can use it and the 85 years can. So we have 2 buttons in the app: start measuring and send result. This has been tested in the elderly care houses in Finland, plus 85 years old people, and which are not so tech savvy really, but the, in the worst cases also nurse can do it, but it's the same thing. And what we actually are providing, it's the algorithm. And the algorithm, it detects the 4 most common arrhythmia types, and we make the integration to the electric health records, and also with some other devices through the HL7 FA solution. And we can use any device, not only ours, that produce ECG. We actually have a now partner testing here in Madrid, and they have a simple ECG device. They give us the feed, and we give them the results automatically. Now, so there are 2 options. Either just the algos, so we can have all kind of partners, well-being companies, data platforms, smartwatch companies, and rings, whatever scales, whatever you can use for measure, because we just need the feed. And with our device and the algorithm, we are looking for the partners for the private and public healthcare system, the providers, the hospital chains, the heart clinics, and so on, so that they can do remote monitoring to avoid these risks. So where is the beef here? This is the most important thing, is that the why AI? AI is because 94% of the doctor's cardiologist time can be saved if he doesn't have to read these endless ECGs, because he can only concentrate, or she can concentrate on the relevant issues, on the results where there's some significant findings, and so it saves both the doctors and the nurses' time. So what can be found, it's different type, it makes a difference what type of arrhythmia, if it's tachycardia or bradycardia or whatever, or AF. So it saves a lot of time when you know it on the beginning. Now, little bit, there are some devices already in the market, and some of them are more like consumer electronics, but where we differentiate is that we have the most accurate one. We have reached the 100% of specificity, which no one else does, and we can provide also the ecosystem, and we have this AliveCore, is a US company. They actually received FDA warning now, so they had to take the solution out for the back to the development. And what is also significant here is the range, heart rate range. Because if you have heart problems, it's either the low end or the high end. And all the others are somewhere in the mid-range. So, so this is very important. Now, what kind of use cases? They're quite simple. So many of these arrhythmias, they remain unidentified. So you do remote monitoring randomly whenever you feel like it. You can test it at home or wherever, because it takes only 30 seconds to put this device on top of your heart. And also to catch this hidden AF thing is to do this screening. And this screening can be done in a massive scale, very fast with this kind of a solution and device. If you think about that, everybody have to be invited to some hospital and put in the Holter. This is really time-wasting an issue, and you have to avoid. It's also the cost effectiveness which is significant. Now, we started 2016, and this is a funny, I have startup experience. Normally, software companies, we write some kind of a line of code, and that's it, you start the company. But now we need to do preclinical testing, clinical testing, and then we can start. And now we have get all these approvals and the CEs, and oddly enough, our first clients are in Australia. The private and public chains there, we found a distributor through the science community. One of the cardiology professor contacted us and said, well, I could help you, you know, with these local FDA approvals and everything and find you a distributor. And that was very nice. So we have two types of approaches for the public and the private. Because for the public, it's more like a licensing solution. But with the remote monitoring, the on-site visit reduction is very significant because this is resource allocation. And I know that here in Spain, not only here in Spain, but everywhere basically it's difficult to get the doctor's time and also to reduce the cost of the stroke patient. I don't know, I read a study. Unfortunately, I have to say that the life is cheap in Finland. They say that it's only 100K, the price of a stroke. My colleague in Switzerland said it's about 500,000. So I don't know how much it is in Spain, and I really don't know how they do it. But it's the lost tax revenues, lost productivity, and of course the treatment. And occupational health care is important in Finland and in Scandinavia because by law we need to have this provided each company to the employees, and we are now negotiating with the biggest Finnish company providing this in both in Finland and Sweden. For the private side, we work with the revenue share, and the doctor recommends this system, and then the patient or client uses it, and the private hospital or clinic invoices it. So to end, I can provide this presentation, whoever is interested, just to remember that those names which are underlined, they really have done more than 1,300 publications in medical journals about arrhythmia, about remote monitoring, and each and every one of those 1,300 publications can be found if you have time and interest. So thank you. So this is what I wanted to tell you.